I wanted to talk to you a little bit today about advice that I gave one of my patients about how to consider exercise choice selection when you have lower back pain that you're feeling better with, but you haven't recovered from yet. So we're going to talk about some spine-safe options that you can do in the kind of, I'm almost out of the woods, but I'm not quite out of the woods yet point in your practice. So forelegs. A great general rule for when you have low back pain and you're recovering is that exercises that you do on just one side, unilateral exercises, are always going to be a little less challenging on your spine than exercises that you have doing on two legs. So lunges are a great option for the recovery stage of your movement. Obviously, you might need to be careful about how you pick up the weights that you're using to load the exercise, but I have picking things up in another video that you can go check out if you need to. I would, in general, avoid any bent over motions during the recovery phase unless you already have some immaculate core control. If you have immaculate core control, go have fun. Great replacements for these exercises could be choosing vertical pulling motions instead of horizontal pulling motions. So replacing a pull down with a bent over row. If you are going to do horizontal pulling, getting yourself into a staggered stance, and then using a cable pulley as opposed to using just a weight that's inside of your hand. Great alternatives are also kind of any of the machines that are in the gym. If you're at the point where you're tolerating sitting well, then the leg extension machine, any hamstring machine that's in the gym, any adductor, abductor machine should all be pretty tolerable for you to use so long as you can get into the position to use them well. None of this is advice. This is a framework for how I understand how one could make exercise choices as they're coming off a low back injury. So make sure that you consult with a healthcare professional if you're not sure if these exercises are right for you. So we got use cables when appropriate, use one-sided movements as opposed to two-sided movements because they cause a lot of spinal compression. And that should actually be a pretty great starting point for one if one's wanting to get back to physical activity. Thanks so much for your time. Have a nice day.